Adnexal masses. We will be discussing about uterine and ovarian tumors, mainly the adnexal, which are the ovarian and tumors of the area which is involving the tubes, the fallopian tubes and ovaries itself. For uterine and ovarian tumors, there are few things which we have to consider. The first thing is the site, shape, dimensions, the contour of the tumor, its contents, echo texture, how it appears, infiltration, any other structures which are being involved by this tumor, any calcifications, artifacts, especially the beam attenuations, and vascularization of that tumors. The uterine and ovarian tumors, if we look at these things, we can differentiate between the malignant and benign pattern. If we look at site, the benign tumors will be indifferent, and similarly the malignant, their pattern is also indifferent. Shape, the benign tumors are usually rounded, whereas the malignant tumors are mainly irregular. We can have a roundish or rounded pattern of the malignant tumors, but with passage of time, they become irregular. Dimensions, often small, are the benign, whereas the malignant tend to be larger because of the excessive or rich vascularization. The contour will be regular and well defined in benign, whereas in malignant it is irregular and ill defined. The contents are liquid or solid, mainly homogeneous, whereas in malignant we can have solid tumors with necrosis and are inhomogeneous. If you look at echo texture, the benign will be hypoequic or isoequic or hyperequic, whereas the malignant tumors, as they are rich in vascularity, tend to be hypoequic on ultrasound. Talking about the infiltration, usually absent in benign, whereas we get the infiltration which is usually present in cases of malignant pattern. In benign tumors, we can have calcification, which is occasionally or sometimes present, whereas in malignant, we can have usually absent infiltration. Benign attenuation mainly absent in benign tumors, whereas is often present in malignant tumors. And if we look at vascularization, in benign will be poor. It is benign pattern. You can get a feeding vessel, but it is not rich in vascularity, whereas in malignant tumors, we will get a rich vascularity, peripheral as well as central vascularity. Most ovarian masses are cystic and benign, unless significant findings are there. Above 7 mm in diameter, persistent beyond the length of a normal menstrual cycle.